Really our goal for treatment with interventions in the whole spectrum is to provide a customized treatment care package for patients.
When you look at the conditions we treat, they're common and they're prevalent. And I think we've been learning more and more about how prevalent they are over the last decade. A combination of technology and expertise now has brought to the forefront therapies and treatments that really make a difference.
The joy that this profession brings to me is the ability to alleviate patients' pain. It's very rewarding to have that interaction with the patient.
Hurricane City is doing, it's called a closed point of distribution today, a closed pod, where they're actually having all of their employees come and receive pretend medication lifesavers that they would actually be able to go back and train and educate their families about this is the event that's happened, this is the disease that we're protecting you from.
Today it was very important for us to be able to practice the process of getting the medication to our employees. We want to make sure our employees are able to continue their work functions that they will need to do as if we do have a pandemic event or we do have a disaster. We want to make sure that our employees receive their medication, make sure they're healthy, make sure their families are healthy, so that they can focus on their job responsibilities that are going to be needed, so that we can make sure that our community is taken care of.
We want our service personnel to be ready and prepared and have the medicine so that we can continue to save lives and take care of the people who need it.
The Center for Disease Control, there's really 5 stations that have to happen when we medicate anyone. So the first one is just a greeter triage. So they come in and we say, you feeling okay today? If you have any of the signs and symptoms, especially for the disease that we're concerned about, we send you directly to the treatment area. The second one is education. Do you know why you're here? Do you know why we're here to protect you? The third station is registration, where we have to keep record of who we're giving the medication to. The fourth station is screening, where we screen, are you pregnant? How much do you weigh? And the very last station is we dispense the medication to them. And then when they exit, we answer any questions.
That's why we exercise it, so that whatever we're not prepared for, we can see what those are now, so that we can be prepared if it does really happen.
When you say emergency preparedness, people often think, oh, it's non-events or we never have events, but if you're prepared, then they are non-events because we have the preparedness programs prepared in advance.
I just appreciate Hurricane City and all that they're doing to practice and train on this. This is the first time we've ever done it in the 10 years that I've worked at the health department. So it's kind of awesome that we're actually seeing a lot of our closed pod partners step up and do the next step.
We're very grateful for our mayor, our city council, our city administration, our city manager for allowing us to take the time to come and do that. We're grateful for those who are here today to help, filling the different positions and different spots necessary to be able to do this.
An ounce of prevention is worth a pound of cure.